COVID-19 question and answer session. On this edition from Toronto, respirologist Dr. Samir Gupta, and in Halifax, an infectious diseases physician, Dr. Lisa Barrett. Welcome to both of you. And Dr. Gupta, let's start with the first question to you. How long do pandemics usually last, and how long can we expect this one to last?
Okay, so if we look back, we usually would have 2 or 3 pandemics every century. The last one we had was in 2009, and that was the swine flu pandemic. And typically they'll last 12 to 18 months. Now the challenge with extrapolating, though, is for a couple reasons I think that's risky. One is that these pandemics are usually mutated flu viruses, and this one, as we know, is different because it's a coronavirus. The other is, I would say, the world is a different place. So in terms of how fast it's spread, there's a lot more domestic air travel now than there was even 10 years ago. And then the other is on the mitigation side. The kinds of strategies that countries all over the world are now undertaking are probably more extensive than anything that's ever been done before. So hard to compare timelines.
Dr. Barrett, is there at least some kind of measure that you and your colleagues are looking at to know when we've gone through the worst of it?
Generally, during any infectious disease outbreak, we watch to see when the most cases in the shortest amount of time happen. And so we do a curve to look at when the curve is going up and when we reach the peak as we slowly come down on the other side. So the number of new cases per day, per week, per month, when that starts to go down reliably over multiple time periods, so multiple days with fewer cases, multiple weeks with fewer cases, that's when we start to think that if we keep up with our mitigation strategies, as Dr. Gupta just mentioned, that we may be on the end of the first wave.
Even as you describe that, it sounds nice to hear something that we can look forward to, hopefully, if we continue these measures. Dr. Gupta, next question to you. With the 14-day mandatory quarantine for returning Canadians, are they allowed to leave their house to exercise or walk their dog?
I would say that the quarantine really is in place to protect others. So if you're returning from travel, by definition, you are at high risk. So you really need to respect that quarantine. You can go out in your own space, in your own backyard for a walk, but I would ask people not to actually go into public spaces or even onto the street while they're in that 14-day quarantine period.
All right. And Dr. Barrett, last question to you. When a person is an asymptomatic carrier of COVID-19, how long are they contagious for?
When people don't have symptoms, they are minimally contagious to other people because they're not sneezing or coughing or spreading droplets. However, we do know the virus does shed for some time. What's not clear at this point is whether you're contagious after you've had symptoms and recovered and are shedding. So right now, that 14-day incubation period before you get symptoms should be very, very respected.
We have less than a minute. I want to quickly ask this question to each of you. And Dr. Gupta, I'll start with you. What's the mood like in your practice in your city right now?
Well, I had a clinic today. It was a virtual clinic. I did it from home in my pajamas, so that's sort of the new reality. My patients pretty much all asked me what would happen to them if they got this infection. My patients have respiratory diseases, so people are worried, people are scared.
Dr. Barrett in Halifax?
We're just starting to see a ramp up in our numbers here in Halifax, so we're a little behind Toronto. People here have generally been pretty good about staying in. There's a lot of worry and concern, but my patients have been very good about doing virtual visits and really supporting each other and actually reaching out to healthcare workers to support them and tell them they appreciate what's being done. So lots of planning and lots of appreciative people who are staying home. They're staying out, staying in and not going out, which is really very much what we appreciate.
And we appreciate the time that each of you are taking with us tonight. Thanks very much.